I'd like to introduce the next speaker, Dr. Stefanie Hectors from TMII, who will be presenting a selected abstract on quantitative comparison of luminal water imaging with diffusion for characterization of prostate cancer aggressiveness. These are early results.
Well, thank you for that introduction. So I'm kind of switching gears back to MRI again, although I believe this technique could be very useful also in combination with PET imaging in the future. So just a short introduction to this luminal water imaging. It's a recently introduced MRI method that uses multi-component modeling of T2 mapping data, and it has shown promise both for detection and grading of prostate cancer. However, it is still unsure whether this technique really has additional value compared to diffusion-weighted imaging. So that is what we wanted to assess in this particular study. So just some introduction on this new technique. It employs the fact that in benign prostate tissue that there are a lot of small uniform glands in this tissue which are filled with liquid, so they have a long T2. While when prostate cancer progresses to more aggressive grades, these glands are replaced by tumor cells which have a smaller T2 value. So when you do T2 mapping with a lot of echo times, you can employ this multi-component modeling to differentiate between this cellular tissue and these glands which have luminal water. So for example, when you have a benign prostate cancer pixel, here you see example of a T2 decay curve, which normally has a very slow T2 decay. And when you use this multi-component modeling, you can find two distinct peaks, one with a smaller T2, which is mostly related to the cellular tissue, and then a distinct peak with long T2 values, which is coming from those luminal glands. Well, in prostate cancer pixel, you have much more cells, so the T2 decay is much quicker. And when you again do this multi-component modeling, there is a very high peak of small T2 values, while there is a much smaller peak of high T2 values, which can be attributable to glands that are still present also in cancerous tissue. So we employed this technique and we wanted to compare the diagnostic performance of this luminal water imaging to diffusion-weighted imaging for differentiation between benign and prostate cancer tissue, and also to assess its utility for assessment of prostate cancer histopathological aggressiveness. And this is still an ongoing study of prostate cancer patients that undergo prostatectomy or surgical removal of their prostate. So until now, we have included 30 patients in this study, of which 20 patients eventually underwent a prostatectomy until now, and we analyzed data of 18 patients. Here you see acquisition parameters of these protocols. So the luminal water imaging was added to the standard multiparametric MRI protocol that is performed at our 3 Tesla clinical Siemens Skyra system. So for luminal water imaging, we used the actual turbospin echo sequence with 30 echoes ranging from 30 to 900 milliseconds with an acquisition time of around 6 minutes. For diffusion-weighted imaging, we just used our standard of care clinical diffusion protocol, which is a single-shot spin echo EPI sequence with B values ranging from 50 to 2000. Some details on the analysis. So we drew regions of interest on a single slice in the index prostate cancer lesions, both on the diffusion-weighted imaging and luminal water imaging, and then quantified parameters in these ROIs. For the luminal water imaging, we used a regularized non-negative least squares algorithm to estimate luminal water imaging parameters, which are the short T2, the long T2, the mean T2, and this luminal water fraction LWF. And then for diffusion-weighted imaging, we just estimated the ADC parameter values. Here you see some characteristics of the lesions that we included. So most lesions were located in the peripheral zone of the prostate. The Pirate score, which is the radiological score that are assigned to prostate cancer lesions. Most lesions were assigned Pirates 4 or 5, which means that these lesions were really clinically significant. And then we retrieved also the prostate cancer grades from the prostatectomy reports. So the Gleason score is kind of the classical way of grading prostate cancer on histopathology. So most lesions had a Gleason 7 score. And this grade group system is kind of a recently introduced reclassification of the Gleason score, which separates Gleason 3+4 and 4+3 into separate grade groups. And for these grade groups, we saw that most lesions had grade group 2. Well, here you see an example of this luminal water imaging and ADC in a patient with a large lesion in the left peripheral zone, as shown here in blue. This luminal water fraction map showed a marked decrease in the prostate cancer lesion compared to the surrounding tissue. And also on the ADC map, we saw a decrease there compared to benign tissue, which is expected. Then we looked at the diagnostic value of each of these parameters for differentiation between benign peripheral zone and prostate cancer tissue. Well, we found that all the parameters were very significantly different between benign and malignant tissue, with p-values of below 0.001. And also looking at ROC analysis, we found very high AUC, at highest for the short T2 with an AUC of 0.99, but also very high AUCs for ADC with an AUC of 0.98. So based on this, we don't believe that this luminal water imaging technique really has additional value for detection of prostate cancer. However, we think that it may have very interesting utility for assessment of prostate cancer aggressiveness. So for example, what you see here is that luminal water fraction showed a significant negative correlation with the grade group, which was also a slightly stronger correlation than with the ADC. And also interestingly, when we compared the different parameters between low-grade and high-grade prostate cancer, so grade group below 3 and equal to or higher than 3, we found that the ADC was not significantly different between low-grade and high-grade cancer, which has been shown in previous studies before, while this luminal water fraction actually did show a significant difference between the different tumor grades. And also when looking at the ROC analysis, we found a high AOC of 0.8 for the luminal water fraction for differentiation between low and high-grade prostate cancer, while the ADC showed a smaller AOC of 0.72. So as I said, all the parameters already showed excellent diagnostic performance for differentiation between benign and malignant prostate cancer tissue. So for detection, this technique may not have a lot of value. However, in particular for really prediction of the aggressiveness or the Gleason score, I really believe that this technique may have substantial value for multiparametric MRI of the prostate. A few limitations of this study include a small sample size, but we are still recruiting patients for this study. And the prostatectomy was also not performed as a whole mount prostatectomy, which in a way complicates spatial co-registration between MRI and pathology. So in conclusion, I think that our preliminary results already suggest additional value of this luminal water imaging technique for characterization of prostate cancer, and we will further validate that in our ongoing prospective study. So I want to thank everyone that collaborated, and I also want to acknowledge funding from Prostate Cancer Foundation that I retrieved for this study as well. Thank you.
Any questions from the audience?
Yep.
Yes, you mentioned that you collected the diffusion data with 4 p-value.
Yes, that's correct.
And when you mentioned the ADC, which ADC is it?
Yeah, I know that's what you mean, because of course at higher B values you can have non-Gaussian diffusion effects. That's what you're. So actually, like this ADC that we use now is really from the scanner, so it uses all B values. But in separate MATLAB analysis, I also look at just 50 and 1000 to kind of eliminate those effects, which may be more accurate, I would say, for assessment of the ADC.
And I also have a question. So I'm not a prostate expert. But why did you choose to compare the luminal water with diffusion? Like, why not DCMRI, for example? It's used in the prostate a lot. Would it make sense to look at other imaging modalities too?
Yeah, that's a good question. So DCE MRI is indeed used in the prostate, but its value, really diagnostic value, is considered limited. And in a previous study, actually, that I did, comparing different diffusion-rated imaging techniques in the prostate, I also found that some of the techniques are really reflective of the content of water or lumen in the prostate. So it's, I think diffusion is more sensitive to this luminal water than, for example, DCE MRI.
Thank you again.
Thank you.